Hi, my name is Cheri, and I live in North Carolina. I have two grown sons, one who lives in Austin, one who lives in North Carolina. I have a husband that I've been married to for 32 years, and I have a lovely golden retriever and poodle puppy named Oakley. I've been in healthcare for several years. I've been a nurse and medical transcriptionist and have done billing and coding. In my free time, I like to travel, bake, and love to watch airplanes at the local airport observation decks. My diagnosis is PV, or polycythemia vera. I hope that by sharing my story with PV, I will help somebody to be able to do their own research on polycythemia vera and be able to advocate for themselves like I have. Unbeknownst to me, I actually had symptoms that were of PV before I was diagnosed, and those symptoms included some dry eyes, some red flushed skin, cheeks and chest, and I also had some visual disturbances and dry eyes, so that was actually likely a symptom of PV. I actually kind of blew off a lot of the symptoms or blamed them on old age or worsening vision, and it wasn't until I went to my physical a few months later that I had the routine blood work that my doctor found that my blood counts were elevated, my red blood cells, white blood cells, and platelets, which prompted her to set me up with a hematologist. I felt frightened because even though I've been in healthcare for so long, I had never heard of polycythemia vera, and I had read a little bit about it and knew that it was a cancer. At first, I didn't tell anybody, including my family, for about 2 weeks because I didn't want to mention the C word. I was still uncomfortable mentioning the C word because I didn't want sympathy and I didn't want them to be afraid. So after about 2 weeks, I kind of eased them in on the diagnosis. After I was diagnosed with PV from my hematologist, we talked about hydroxyurea, which she put me on and told me that, this is going to work well. It will control my counts. And after that, I started doing a little bit of my own research, and I joined some support groups. I learned about BESREMi on some of the support groups, and then when BESREMi was first approved by the FDA, I brought that information to my current hematologist and told her that I was really very interested in trying BESREMi because I had heard about the good that the interferons had done and just had read that BESREMi was specifically approved for PV. So that's when she sent me to the MPN specialist.
Important safety information. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects that may cause death or may worsen certain serious diseases that you may already have. Tell your healthcare provider right away if you have any serious side effects during treatment with BESREMi. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi. These symptoms may go away in some people after they stop taking BESREMi.
Well, when I went to the MPN specialist and talked to her about wanting to be on an interferon, she explained to me that BESREMi worked by targeting the actual bone marrow itself, and we just went from there. The self-injection process was a little scary for me at first because even though I've given many injections, I've never given one to myself. So I went on to BESREMi's website and reviewed the video a couple of times. It was very easy to understand, so I felt pretty comfortable doing it after that, and you can barely feel the needle. To increase my dose of BESREMi, I'm still having blood work done every month like I have been for quite some time now. And then the pharmacist works with me on adjusting the dose. She'll email me and let me know what my blood results were, and then she tells me which dose to take. I'm really happy with how BESREMi has met my treatment needs. My blood counts have been completely stable for almost a year now. I've only needed one phlebotomy, and I'm taking far fewer pills than I did years before. I haven't had any significant side effects with BESREMi. The only side effect that I think might be related to BESREMi is some itching after a shower. So I found that if I take an antihistamine before I take a shower, that I don't have very much itching afterwards. My overall experience with BESREMi has been very good. I feel like I've taken charge of my own health by advocating for myself and asking to be on BESREMi. So I'm very comfortable that this is the medication for me for the long term. My advice for others would be to When you're first diagnosed, don't just start Googling. If you want to gather some information, I would suggest going to a legitimate website like the Mayo Clinic or the National Institutes of Health. And I would also suggest getting a hematology oncology specialist that is very familiar with MPNs because they're so rare, so that you can ensure that you're advocating for yourself and getting the best treatment for you. My outlook on life is very different than what it was before PV. Initially, it was kind of upsetting to know you have a chronic blood cancer. But in the long run, nobody knows how long we have to be here. So I look at each day a little bit differently now. I look at each day as a gift, and I put what I value first, family, friends, travel, and the things that make me happy is what I focus on now.
Important safety information continued. What is the most important information I should know about BESREMi? Continued. Mental health problems, including suicide. BESREMi may cause you to develop mood or behavior problems that may get worse during treatment with BESREMi or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, feeling bad about yourself or feeling hopeless, unusually grand ideas, acting aggressive, acting impulsively, or thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, you, your caregiver, or family member should call your healthcare provider immediately. Your healthcare provider should carefully monitor you during treatment with BESREMi. New or worsening autoimmune problems. BESREMi may cause autoimmune problems, a condition where the body's immune cells attack other cells or organs in the body, including thyroid problems, increased blood sugar, hyperglycemia, and type 1 diabetes. In some people who already have an autoimmune problem, it may get worse during your treatment with BESREMi. Tell your healthcare provider if you have tiredness, are urinating often, or if you are very thirsty. Heart problems. BESREMi may cause heart problems, including problems with your heart muscle, cardiomyopathy, heart attack, abnormal heart rhythm, atrial fibrillation, and decreased blood flow to your heart. You should not use BESREMi if you have high blood pressure that is not controlled, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, or a recent stroke or heart attack. If you have a heart problem before you start using BESREMi, your healthcare provider should monitor you closely during treatment with BESREMi. Who should not use BESREMi? Do not use BESREMi if you have or had severe mental health problems, especially severe depression, thoughts of suicide, or attempted suicide. Have or had a serious or untreated autoimmune disease. Have had a serious allergic reaction to another interferon product or to any of the ingredients in BESREMi. Symptoms of a serious allergic reaction may include itching, swelling of your face, tongue, throat, trouble breathing, feeling dizzy or faint, and chest pain. Have certain types of liver problems. Have received a transplant and take immunosuppressive medicines. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression, and have had thoughts of hurting yourself or others. Have type 1 diabetes. Have or ever had any problems with your heart, including heart attack or high blood pressure. Have or ever had bleeding problems, a blood clot, or low blood cell counts. Have a condition that suppresses your immune system, such as certain cancers. Have hepatitis B or HIV infection. Have kidney or liver problems. Are pregnant or plan to become pregnant. BESREMi may harm your unborn baby and may cause loss of your pregnancy, miscarriage. Before you start using BESREMi, your healthcare provider should do a pregnancy test. You should use effective birth control during treatment and for at least 8 weeks after your final dose of BESREMi. Talk to your healthcare provider about birth control choices for you during treatment with BESREMi. BESREMi can affect your menstrual cycles and may cause your menstrual periods to stop. Tell your healthcare provider if you become pregnant during treatment with BESREMi. Are breastfeeding or plan to breastfeed. It is not known if BESREMi passes into your breast milk. You should not breastfeed during treatment and for 8 weeks after your final dose of BESREMi. What are the possible side effects of BESREMi? BESREMi can cause serious side effects including decreased blood cell counts. Your healthcare provider should check your blood cell counts before you start and during treatment with BESREMi. If your blood cell counts are too low, you can develop anemia, infections, or have problems with bleeding or bruising. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nose bleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions and skin reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Your healthcare provider may stop BESREMi if you develop new or worse eye problems during treatment with BESREMi. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Your healthcare provider may stop BESREMi if you develop severe kidney problems. Tooth and gum periodontal problems. BESREMi can cause tooth and gum problems, which can lead to tooth loss. BESREMi can also cause problems with dry mouth that can damage your teeth and the lining of the mouth during long-term treatment with BESREMi. It is important for you to brush your teeth well 2 times each day and have regular dental examinations during treatment with BESREMi. Skin problems. BESREMi can cause skin problems. Signs and symptoms of a skin problem with BESREMi include itching, hair loss, rash, redness, psoriasis, acne, thickening of the skin, or excessive sweating. Call your healthcare provider if you develop a rash that is bothersome or covers a large skin area. The most common side effects of BESREMi include flu-like symptoms including tiredness, weakness, fever, chills, muscle aches, and joint pain, itching, sore throat. What is BESREMi? BESREMi is a prescription medicine that is used to treat adults with polycythemia vera. Please see full prescribing information, including boxed warning and medication guide for BESREMi.